Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. In today's episode, a brief conversation about last week's events at the Centers for Disease Control and Prevention between Dr. Tom Frieden, the agency's former director, and Dr. Josh Sharfstein. Let's listen.
Dr. Tom Frieden, thank you so much for joining me this week on Public Health on Call. It's been quite a week for public health, and particularly for the agency that you used to lead, the Centers for Disease Control and Prevention. How are you doing?
Well, it's a sad week, Josh, to be honest. It's not just that there's an unprecedented termination of a CDC director. That's never happened in 80 years. It's not just that 4 of the main leadership of CDC resigned in protest. I know all of those 4 people. They're deeply dedicated to their work, to protecting Americans. They have no political agenda. They only have the agenda of making America healthier. But what's so concerning after cuts that have resulted in apparently more than 2,000 CDC staff losing their jobs, the closure of half of the Centers for Disease Control and Prevention, is that we really are in a dangerous time. We're seeing vaccine policy getting hijacked by unscientific and dangerous and disproven views. We're seeing programs that are life-saving to reduce tobacco use being dismantled. This is a dangerous time for health and public health in this country.
It is reported that the reason that the CDC director, Dr. Monarez, left was because she refused to promise that she would accept recommendations without looking at evidence on vaccines.
It's not just about statements that are false, and we've seen many of those from the current health secretary. It's not just about the membership of a committee, and we've seen highly qualified people who do not have conflicts of interest replaced with people who don't have qualifications or expertise. But if that committee, the ACIP Advisory Committee on Immunization Practices, doesn't recommend a vaccine, I think it's quite possible the Vaccines for Children program will not be able to cover it. And that means that the half of American children who rely on the Vaccines for Children program, a great bipartisan success story, will either not be able to get vaccines or have to pay for them. So we're looking at really a dismantling of our health protection.
And we're already hearing about certain pharmacies in a number of states that are not offering the COVID vaccine, in part because of delays in recommendations from this committee that may never come. And that will affect access to vaccines for everybody, even the people who are recommended for the vaccine. Let's talk about the other centers that you mentioned are losing staff or getting shut down altogether. What is the impact there?
Let's take the tobacco control program. The FDA regulates products. The CDC supports programs. It's the only agency that tracks trends in tobacco use, supports comprehensive tobacco control programs in cities and states. It means quit lines around the country may close or be less functional. It means we may not know the next risk that the tobacco industry leashes on our kids to get the next generation addicted. It means that programs that see whether our programs are working are going to be endangered or stopped. And what does that mean in the end? It means more cancer. It means more heart attacks. It means more strokes. It means higher healthcare costs. This is one of the ironies. The Vaccines for Children program has saved literally trillions of dollars. It's prevented hundreds of millions of infections. And by one estimate, more than 1 million deaths of Americans. And it is now very much at risk.
Let's talk about environmental health. There was a story about, I think, the Milwaukee health commissioner trying to get assistance for lead in the water, I believe, and nobody picking up the phone at CDC. I remember calling CDC when I was the health commissioner in Baltimore City for an issue with arsenic in the soil, and that call late at night made a whole lot of things possible, including recognizing the risk, shutting down the park, and figuring out what to do from there. I'm worried about that phone going unanswered. How do you think about that?
For 80 years, I'll pull back the curtain here, as people in public health know, there's something called an epi-aid, or a request for assistance from a jurisdiction. And as far as I know, the Milwaukee incident was the first time in the 80-year history of CDC that someone has called and said, we want help. And CDC has said, we can't. We got no one here who can help you. And that's just terrible. And it's not just about lead poisoning. It's about a whole range of health programs: cancers, environmental poisonings, heart disease, stroke, birth defects, including autism. On the one hand, you have an administration that's set some very important goals and has done some things that are, I think, good, like allowing states to improve the healthfulness of the food and the nutrition program. But at the same time, it's been shutting down programs that protect Americans. And in the name of improving the program, what it's done instead is essentially destroy it.
My last question is, for you personally, I mean, having led an agency like this, knowing CDC so well, this must be a particularly difficult time. What is the nature of your conversations with people? How do you keep them focused on doing the most that they can do in this moment?
It's sad. People who have spent 10, 20, 25 years of their lives building a program, they could have made more money in the private sector. They could have worked fewer hours in the private sector. They did it because CDC works 24/7 to protect Americans, whether it's from infectious or other diseases, whether it's from man-made or naturally occurring diseases, whether it's from health threats that arise in this country or anywhere in the world. And that protection system is very much at risk.
Tom Frieden, thank you for taking time from your schedule today to check in with us. It's very good to see you. Thank you for doing this.
Thank you, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.